Good morning. Thank you for joining us to learn more about COVID-19 in our county amid concerns about the Delta variant and rising case rates and spread of infection. In addition to today's press conferences, we continue to provide daily updates on the website at publichealthsbc.org, through media and social media, and a weekly report sent via email to subscribers. Today, you will hear from the county's Director of Public Health, Dr. Vaughn Do Reynoso, and Dr. Henning Ansorg, the county's Public Health Officer. Following their updates, we will open it up to questions from the news media. This press conference is being interpreted in Spanish by Carlos Saracedo and in American Sign Language by Shelley Lawrence, supported by Julia Townsend. Videos of the press conference will be available shortly after the conclusion in both English and Spanish, posted on the county's YouTube channel at CSB TV 20. And with that, I will turn it over to County Public Health Director, Dr. Vaughn Do Reynoso.
Thank you, Gina, and good morning, and thank you for spending your morning with us. I'd like to start by sharing some data with you. Can I have my slides? So when we look at what's happening in our county with regards to case rate, we'd like to show you a comparison of case rate by vaccination status. So I'd like to point your attention to the line that's in black that says 12.2. So on July 20, our community case rate by 100,000 stands at 12.2. But when you look at that case rate and drill down, the red line shows 19.1. What this means is that the case rate per 100,000 among the unvaccinated stands at 19.1, with the blue graph, the lowest graph, at 5.6. That is the case rate among vaccinated individuals. So as of July 30th, cases were nearly 3.4 times more likely to be unvaccinated than vaccinated. And so this really is a compelling graph that shows this is why we need to have a masking mandate for indoors. Next. Vaccination rates. As of today, we have 62.2% of eligible Santa Barbara County fully vaccinated. But the more important note here is that there are still 144,383 eligible Santa Barbara County residents still unvaccinated. So this is a missed opportunity. Next. With regards to COVID-19 hospitalizations, we are showing, this is data from May and June, we are showing that 89% of our hospitalizations are due to unvaccinated. So, and with only 11% of our COVID-19 hospitalization patients being fully vaccinated. So again, this really is a compelling data that guided us towards our health officer order for mandating of masking for indoors settings. Next. I'd like to share with you case transmission. So as of August 4th, of those with known documented transmission status, we have 44% community close contact and 48% to community transmission, with only about 8% due to travel. So the takeaway here is that there appears to be more community transmission occurring of those that know where they were exposed. And again, this really paints a picture why we have issued our new health officer order. Next. So our new health officer order will be effective tomorrow, August 6th at 5 p.m. And it is mandated masking in public indoor settings, regardless of vaccination status, for persons 2+ years of age. We need to do this because this is a critical strategy to stem rising case rates. We will review this health officer order and guided by case rate, vaccination rate, and hospitalization rate and capacity. So thank you. And with that, I'd like to introduce Dr. Ansorg, our County Health Officer.
Thank you, Dr. Dorenoso. And good morning, everyone. I would like to make some remarks about this new phase of the pandemic we are finding ourselves in. In late May and early June, we experienced only minimal community transmission, and most of us thought that we could have reached herd immunity and the pandemic would be essentially over. As of June 15th, we felt comfortable to lift most public health mandates, especially for vaccinated people. At the time, however, we were dealing with a very different version of the coronavirus. Unfortunately, the new Delta strain of this virus emerged rapidly in late June and July, causing a steep rise in cases and hospitalizations. This version of the virus is behaving very differently types. Once a person is infected, Delta takes a shorter time to make the infected person ill or enable them to spread the virus without having symptoms. This incubation period is only 4 days for Delta compared to 7 days with the previous virus. The Delta virus replicates much faster, leading to higher concentrations of virus in the infected person. It also appears to linger longer once a person is infected. It is able to lock on to the respiratory tract cells more easily and securely. All of these new features enable the Delta variant to be almost as contagious as chickenpox. Unfortunately, Delta is now able to infect even vaccinated persons, who sometimes can spread it even further. Vaccinated persons are fortunately very well protected from serious illness and death from COVID. So please don't get me wrong. The vaccine is absolutely worth it. Recent events in Princetown, Cape Cod, where large parties and gatherings took place over the 4th of July weekend, showed us just how infectious this Delta variant is. It spreads much easier from person to person. Now, reaching herd immunity will be much more difficult because we would need close to 90% of the population to be immune. The United Kingdom experienced a very large surge due to this virus type, despite the fact that the vaccination rate in the United Kingdom is quite high. In order to block this Delta from spreading more through our communities, we will need to be more vigilant and wear masks in all public indoor settings. We also need to nudge our unvaccinated neighbors and friends to finally get vaccinated. Viruses do evolve. They evolve most when they are given the chance to multiply and swoon through communities. We need the help of our leaders in politics, faith-based organizations, community organizations, and other prominent figures to support the effort to get as many people vaccinated as possible. In the meantime, please play your part in wearing a mask in public indoor settings and avoid crowded outdoor events. Thank you for your cooperation.
Thank you, Dr. Ansorg and Dr. Dorenoso. So we're going to open it up to questions from the media. First, we're going to News Channel 3, who I believe is going live. So we will start with Joe Batista, followed by Scott Sheehan. Go ahead, Joe.
Yeah, Dr. Ansorg and Von Dorenoso, when we have some Fiesta-related questions, obviously the biggest event of the year, and up until Wednesday morning, it looked like some of the big events were going to be continuing. What was the timeline of what was told to the Fiesta folks as compared to what was told to the public when it comes to some of these outbreaks? And what was your guidance for Pequeña in particular?
Well, I can tell you that Stephanie Petlo, the El Presidente for the Fiesta, reached out to public health. Hang on, time is so fast these days. It was the day before the Pequeña, so it was Tuesday morning, and just wanted to have some recommendations from public health, which we were able to give, what would make the event more safe, and that was it. And the committee made their own decisions.
So you never told public health that they needed, or you never told Fiesta that they should not be doing Fiesta Pequeña?
That is correct.
Thank you.
Joe, did you have any additional questions?
Well, I guess hospitals right now, what are they looking like locally? How many people in the hospital are vaccinated versus unvaccinated? I think that's a big question people are wondering.
Yeah, that's a very nuanced question, and I understand that of great interest. Our hospitalization rate, if you look at our dashboard, is in the 30s currently, which is much higher. When we started with the Delta variants, we were at 10 hospitalized for COVID per day. And now, unfortunately, we do see an increase of even vaccinated people who need hospitalization. However, there's a big however, and it is that those folks who will need hospitalization are usually quite old, advanced in their age, and therefore their immune system is not as robust, or they're actually on medication that suppresses the immune system. None of the vaccinated hospitalized patients right now requires ICU care. So it shows that the vaccine is doing its job in preventing severe illness and death from COVID, even in the elderly.
And then I think the last thing for us here, and then we'll open it up to everybody else. Vaughn, you guys have talked about this mask mandate since Tuesday or Wednesday. Why wait until Friday if it's so important to do it? Why not just snap your fingers and say, indoors, you need to wear a mask?
Good morning, Joe. That's a great question. We knew that we wanted to do it when the case rate exceeded 10, but we also wanted to give our business community, our hospitals, our schools, and various community members a chance to process it. So we did inform our electeds on Monday, inform all of our cities and other representatives on Tuesday, and we finalized our health officer order on Wednesday, and we did release it on Wednesday.
Thank you, Joe. I think now we're going to Scott. Ian?
Hi, good morning. So a follow-up to Fiesta, the mask mandate starting on Friday, but what other recommendations do you have moving for the rest of Fiesta, especially with bars, restaurants, and clubs preparing to have their own big Fiesta parties?
Well, we should take our clues from Princetown. Public health's recommendation, our recommendation is avoid crowds, wear masks in indoor settings, to avoid transmission of the virus in the community. So that is recommendation.
Scott, did
so for the other events that are going on, including the rodeo, should they keep going as planned and as scheduled, or should there be distancing or capacity limits or masks being worn?
All those technical decisions are up to the Fiesta committee. We have recommended that crowded events, even outdoors, where people are shoulder to shoulder, laughing, talking to each other without masks, is dangerous, and therefore we recommend masking up even outdoors. But for the indoor setting, it's actually a requirement per health order.
Thank you, Scott. Unless you had more questions, I think we're moving on to, looking for her in the list, Laura Place with Santa Maria Times. Laura? Laura, can you unmute and go ahead?
Yes, can you hear me?
Yes, we can
Sorry
hear you.
about that. Thank you. So as far as outbreaks happening right now, in the press release released about the mask mandate, I think Dr. Dorenoso, you outlined some increases in outbreaks that we're seeing, particularly in long-term care facilities and other communal living facilities. Can you give some more specifics about, some of the, areas where you're seeing this pop up? Is it more homeless shelters? Is it more, skilled nursing facilities or more schools?
Hi, Laura. It's all of the above. We are seeing an increase, an uptick in cases across all the congregate living places that you've just mentioned, all of those categories.
Okay, so even skilled nursing facilities, which were some of the first groups to get vaccinated?
That is correct.
Okay, and do you think that part of why that may be happening is maybe low vaccination rates among staff? Because I think it was a few months ago, you and Dr. Ansork spoke to really low vaccination rates among healthcare workers at those facilities. So do you think that could definitely play a role in outbreaks?
Certainly, when you have a situation where it is not a high vaccination rate, there is always a higher risk, given that it is an enclosed setting. So when we look at situations of outbreaks in congregate settings, we not only mitigate the spread of COVID-19 in that particular facility, but we also come alongside and offer increased opportunities to be vaccinated on site. So I do think that the lower vaccination rates among staff as well as visitors, because these facilities have increased visitors, and all of the above play a role in the outbreaks that we are seeing.
Okay, and then with kind of that mention of visitors, with skilled nursing facilities specifically, and maybe other long-term care facilities, would the county have a role in mandating, the closure of those facilities to visitors again, or would that be a state decision or an individual decision for those facilities?
Great question. Actually, the state will be coming out with all facilities letter pertaining to visitors and the process by which their vaccination status or their testing must be done.
Okay, do you know when you anticipate that coming out?
I don't. Dr. Ansor, were you tracking on when that might be coming out?
Yeah, imminently.
We were in discussion with the state earlier this week. I think it was Wednesday. So I would imagine either tomorrow or early next week.
Okay, thank you. And one last question. As far as enforcement, of these indoor masking rules, I imagine there might be a little more resistance than with, the first mandate. What role can individual cities and law enforcement agencies play in making sure these rules are followed?
It is a legal health officer order, and we are imploring local jurisdictions, local municipalities, cities to take leadership in encouraging their businesses and community members to comply. At the end of the day, as I showed everyone, it is about the rising case rate. It is about the number of people entering into hospitals. It's about saving lives. And so we are really wanting to implore every community member to comply with this indoors masking mandate. It's about saving lives. It's about saving lives of our community members.
Okay, thank you so much.
Thank you, Laura. And before we go to KSBY and the Daily Nexus, Scott with News Channel 3 had one additional question. I'll just read it here. Vaccination cards are starting to be used or considered across the country. New York City restaurants and gyms and Minnesota music venues. When, if ever, will vaccine cards be required in Santa Barbara County to encourage people to get the vaccine?
I would say that based upon the state health officer order for acute healthcare facilities, for skilled nursing facilities, and other healthcare facilities and high-risk congregate living situations, the vaccine verification is in place. With regards to when that would be expanded to other businesses, I don't believe that is a topic that we are entertaining at this point in time.
Thank you, Vaughn. And next, we're going to go to Gina Avalos with KSBY, followed by Atmika Iyer at the Daily Nexus.
Thank you, Gina. Yeah, I have a question. I have a few questions, but going back to what Dr. A mentioned about herd immunity, can we talk about what that percentage was at first and what it is now? Kind of circle back to that.
Yeah, with the initial virus, we would have required anywhere between around 70%. And with this new version, the bar is much higher because it spreads faster and more easily, and therefore 90% would be required.
And what is the county, obviously I know you guys are putting in a lot of efforts within vaccine, but what is something else maybe that you guys may be working on to reach that goal?
We continue to partner with our 23 and growing number of community partners to look at the vaccination rates by zip codes. And that information is on our website if you are interested at the percent of eligibles who are vaccinated and not vaccinated in the zip codes. We are continuing outreach in making sure that the opportunity to be vaccinated happens in a comfortable, accessible, safe place. That on top of just that constant steadfast outreach about information and addressing the misinformation, I think those strategies will allow us to reach that level of vaccination that we desire. And you know, I think the other thing is, as we hear more about how virulent the Delta virus is, and as we hear about personal stories and regrets from community members, I think all of that is contributing to people getting vaccinated. So we are seeing a little bit of an uptick in the number of people getting their first shot. So this just means that we all need together. As Dr. Ann Sorg mentioned earlier, so is eligible, will make that decision, that choice to get vaccinated sooner than later.
And I know last week we talked about outbreaks. Have there been any new outbreaks in the county that we've discovered?
I don't have that information at the top of my my head, whether we have new outbreaks this week, but we are certainly been working on outbreaks and mitigating them from previous
The last
weeks.
question that I have for you is in regards to contact tracing. How are you guys with that? Do you feel like you need tracers, or is there a backlog, or are you guys doing good?
So that is a really, really good question. With the onslaught of new cases, we are redirecting public health staff from our own department to our contact tracing team. And in addition, we have reached out to our county departments who have sent us staff previously during the winter surge. We've already reached out to those departments and they are sending staff to us. In addition to that, we have reached out to the state so that they can send us some additional support. We do have an overwhelming number of cases that we have to process, unfortunately. We shouldn't be here, but we are. So we are scrambling and we will be getting the team to do the work. In the short run, I do believe that by the end of this weekend, with all the redirect staff from our own department and the assistance from other county departments, and we will be working night and day through this weekend, and we will be caught up by Monday.
Awesome. Thank you so much for answering my questions.
Thank you, Gina. And next up, we're going to Atmika Iyer with Daily Nexus.
Hi, everyone. Happy Thursday. I'm so sorry about that. I have a few questions regarding UCSB and responses from the university and public health regarding this upcoming year. So the first one is, obviously in September, we're going to have a large population coming in as everyone gets ready to start their in-person school year. Is public health working with the university to look at anything like mandatory testing prior to moving in?
We are in regular discussions with UCSB leadership. This development is so fresh and so new that we haven't discussed the new testing requirements yet, but I assure you we will before the semester starts. We do know that fortunately UCSB has a very high vaccination rate. That's already a very good starting point.
Got it. Thank you so much. And my second question, and Dr. Answer said this might be a conversation that's happening in the future, has to do with the high density living situation within both Isla Vista and university housing specifically. So will there be, I guess is the way I'll phrase this question, any discussion about rethinking dorming and the amount of people that are allowed to live in such a concentrated location? Will there be any working with community stakeholders to look at the high density living in Isla Vista for the upcoming school year?
Yes, I can assure you that these discussions will be held.
Got it. And two more questions. Have there been any outbreaks at UCSB in the past month or so?
I'm not aware of any at UCSB.
Got it. And last one. So when we had the tier system, there was sort of a manual on what happens when cases get worse. And so without the tier system, are there next steps beyond a mask mandate for when cases get worse, for when we see a higher testing rate?
That's a great question, Attica. We are in such a different state than we were a year ago when the tiered system was put in place. So with regards, we didn't have vaccinations widely available. We do now. So I think the key is really working towards that vaccination of everyone who is eligible to be vaccinated first and foremost. I think that with that is the key that we have to remember. It's we can get out of this pandemic. We can assure safety for our children, safety for our families and our businesses and our essential workers if we focus on getting vaccinations of everyone who's eligible. With regards to further actions, like in the previous and now currently retired tier system, I'm uncertain that we will go down that same path, because again, we're not in the same place as we were previously. So vaccination, masking, and then with what comes along with that is just really being intentional about mitigating your own risk of, as Dr. Ansork said, if you're outside in a crowded setting, remember to wear your mask, maintain your social distance if possible, because these are higher risk situations, especially with the circulating Delta variant.
Got it. Thank you so much.
Thank you, Atmika. And that actually concludes today's press conference. We have no more questions from. So just to remind everyone, county public health experts provide live updates every Thursday at 11 a.m. on KEYT News Channel 3. This press conference today preempted the edition today, but they will return next Thursday. Also, daily reports are posted on the county's public health data dashboard at publichealthsbc.org. And you can sign up to receive email updates, including the Week in Review snapshot issued every Friday. To sign up for e-news, go to countyofsb.org and select Join Our Mailing List in the upper right-hand corner, of the homepage. We ask the community to remain vigilant and help put an end to the spread of COVID. And again, we thank everyone for joining us this morning and spending your morning with us. Thank you so much. Have a good rest of your week and a happy, safe, healthy weekend.